When you face a patient with a horseshoe kidney, it's a challenge for the endocrinologist because the anatomy is different. The position of the colon, the liver, sometimes is very close to the kidney. So the PCNL in those patients is a challenge. When you do PCNL, the classic position for a horseshoe kidney is prone position. However, we presented last month and during the Brazilian Congress 10 cases of horseshoe kidneys that we did in supine position. We had 10 cases, 80% of success, no complications. So it's feasible to do that, and the outcomes aspects are the same. If the patient is prone or supine, what is more important is to have all the equipment and the disposables available. This was a 56-year-old male patient. He had right lumbar pain for 3 years. He was referred for us after 2 previous failed PCNL at the kidney. He told us the history that the doctor could not reach the stone despite the PCNL. So he came for us to solve the case. And we could see in the CT scan that this patient had a horseshoe kidney with 3 stones in the right kidney. The stones had 1 centimeter, 1.3 and 1.4 centimeters. And this was very difficult anatomy to reach the stone. So, however, we can see here in the CT scan that we have a good window to reach the calyx, to reach the kidney without affecting any other organ. So it's very important not to see only these coronal images, but the axial images also. We choose the PCNL for this patient due to a higher chance of success, due to the difficult anatomy. Flexible was also an option, however, the inferior calyx usually is very hard to reach with a flexible. The patient is in complete supine without lithotomy position, and we mark the 12th rib, the iliac crest, and the posterior axillary line and the middle axillary line. We do a cystoscopy, place a ureteral catheter. We use the ultrasound to find the free window to reach the kidney, and we can see here that there's nothing between the skin and the kidney, only fat and skin. So we mark the correct position and do the surgery as we used to do with fluoroscopy. It's important for this case to have the flexible nephroscope available. The stones are here in this inferior calyx. We did a puncture in the upper calyx, placed the guide wire through the ureter, and we always try to use a hydrophilic guide wire to try to reach the ureter. Then we did the dilation with the amplets until 30 French. After placement of the sheath, you can go with the rigid, but however, if you do not reach the stone, go with the flexible. We use the flexible nephroscope to read all the calyx, and then we use the escape basket to catch the stones and remove the stones. Just 1 stone we had to break with laser. It was 1.4 centimeters, and we had to break a little the stone. Resolution was fantastic because the surgery didn't take too much time. We had the 2 stones without breaking and 1 stone break with laser, and all the stones were removed with the escape basket, and the patient was rendered stone-free after the surgery. Horseshoe kidneys is a very challenging case for PCNL, and we are showing that supine is very feasible, totally feasible, and with good outcomes. We can use supine position for most of cases. That's important.